Hello, my name is Rachel Lamb, and this is my video for the JCRS REACH Program at Thomas Jefferson University. Starting off with the first question, what comes to mind when you hear the term rehabilitation sciences, and what do you think it involves? Well, when I first hear the term rehabilitation sciences, I picture this specific scene in Doctor Strange, actually. It's where he gets into a pivotal car crash, and he ends up shattering his whole body. His whole body is injured, from his arms to his legs. But specifically, his hands are injured and hurt. And this is very important for him because he's a neurosurgeon and his hands are basically everything to him in his career, and it puts his career and job at stake. And eventually, though, he starts to heal and recover, and this is all because of physical therapy. But if we're looking into the scope of like the actual definition of it, I think rehabilitation sciences involves medical professionals focusing on helping their patients like regaining the strength to keep on pushing and really seeing that healing journey of it. Moving on to the second question. What types of conditions or injuries do you think rehabilitation professionals help people recover from? I think rehabilitation professionals like help people recover from many things. It could be diseases, it could be a major minor injury regarding like a broken leg, a broken arm, and or like a speech impediment and many more. This field just has so many various things to offer, and I think it's also why this program caught my eye in particular because through this program, I want to see like through lenses of her medical professionals, and this program will like essentially give me the opportunity to do just that. Moving on to question three. Why do you think rehabilitation is important for people recovering from injuries or managing chronic conditions? Well, I think rehabilitation is especially vital because it essentially like casts a bridge between the medical treatment and the real life world, as a doctor could be able to fix a bone or diagnose a condition, but rehab is really like the place and environment where a patient actually like starts to learn how to move and function again as it like prepares the real world to the body to handle the real world again and come back from their hardships and the sufferings they have faced prior. And ultimately, rehabilitation is just about getting back on your 2 feet again and gaining the strength to feel like yourself and finding that like reason to keep on pushing forward again. It gives people the confidence to do everyday things we take for granted. And I do this too, but we take a lot of things for granted. We take eating with our hands for granted. We take walking our own 2 feet for granted. We take a lot of things for granted. And when we get into that injury, um, rehabilitation is that place where we can really recover and find that confidence to keep pushing and moving on forward. And moving on to the last question. Would you be interested in pursuing a career in rehabilitation sciences? Why or why not? I think I'm definitely interested in pursuing a career in rehabilitation sciences, but also just like the healthcare field in general, because for me, I find joy in helping people, and it could be small or big things like opening a door for someone or giving money to the homeless. I just find joy in doing like small things just like that. And overall, like my long-term goal is just to become someone who can help improve someone's quality of life and like just how they live. And I see rehabilitation sciences as being like a perfect foundation for building that experience and also just like gaining a sense of connection to patients because it's not like every career has that ability where you can really gain a social bond and relationship with patients. In rehabilitation sciences really has just that and what I really want and desire. And just like in the future, I just want to be a stable part of helping people get back on their feet as and like provide clear answers if they have any questions for me to answer. I'll try to answer them seamlessly or like effortlessly. But like beyond the technical side, I just want to be part of like that process that helps the patients get the strength to feel like themselves again because I just think there's something so rewarding about being there for someone when they're at like their most vulnerable moments and just like helping them gain the strength to feel like themselves again when they're at their lowest. And fundamentally, for me, healthcare is more about helping people. I think it's just about being a steady support system from the very first scan all the way to them essentially just like graduating and like stepping through that threshold to the real life world again. My name is Rachel Lam again, and this is my video for the JCRS REACH program. Thank you.